Good evening, everyone. A warm welcome to all our esteemed doctors joining us today. As we celebrate the 12th anniversary of DocPlexus, we extend our heartfelt gratitude to every clinician who has been a part of this journey. Over the years, DocPlexus has remained committed to fostering meaningful medical knowledge exchange, and this special anniversary series continues that mission with topics that carry immense public health importance. Today's session focuses on emerging and urgent concern harms of oral nicotine pouches. With the rapid rise in the use of these smokeless nicotine products, especially amongst young youth and first time users, it becomes crucial for the medical community to understand the associated risks, patterns of dependence, regulatory gaps, and the implications for clinical practice and public health. To guide us through this important topic, we are honored to have with us Dr. Rakesh Gupta. Dr. Gupta is the President and Director of Public Health at the Strategic Institute for Public Health Education and Research, Sipher, and the former Director of Health Service, Punjab. He brings 35 years of distinguished experience in public health and, and has led national programs in non communicable diseases, including blindness control and tobacco control, for more than 8 years. His remarkable contributions have been recognized globally, most notably with WHO Award on World No Tobacco Day in 2015. His pioneering initiatives such as corneal blindness backlog free and tobacco free villages have been showcased at the Innovations Conclave organized by the Government of India in Indore. We are honored to have him with us today to shed light on this emerging public health threat. Sir, it's a privilege to welcome you. Thank you for joining us. Over to you.
So I'll be telling you about the overview of the oral nicotine pouches. Next, please. So what is nicotine pouch? Each pouch that contains nicotine that is maybe derived from the from tobacco, or it may be synthetic. And there are some filters, example, micro crystalline cellulose, and then there are sweets and preservatives also there within the pouch. And why the now nicotine pouch is popular? Because the packaging is very colorful. They are small and easy to conceal. They are flavored. There's no smoke, vapor, or spitting, and there's no offensive odor or smell. So these are easy to hide. Next, please. Nicotine pouches, as I told you, they are small permeable rectangles. They contain nicotine that is either synthetic or derived from tobacco. They have flavors. And the tin contains about 15 to 20 pouches, and each is either 3 or 6 milligram of nicotine per pouch, but it may be containing as high as 43 milligram nicotine. Next, please. You may put them in your mouth, most commonly tucked between your gum and upper or the bottom lip. Some sites they tell people to leave it in their mouths for 15 minutes or maybe up to half an hour. And some sites may even tell you that you may keep it for 45 minutes. Similarly, similarities to the nuclear nicotine gums are there. Next, please. But there are two differences between the nicotine pouches and the nicotine gums because the Nicorette or the nicotine gums they don't taste very good because they don't contain flavors. But the nicotine pouches they contain flavors. Nicotine gums they are FDA approved smoking cessation tools, but the nicotine pouches they are not approved by any uh, body, any government body. And ONPs may have nicotine as high as 43 milligram per pouch. Next, please. So there's vascularization of the nicotine pouches, as you can see in the photograph. And the popular nicotine pouch brands, they are Zyn, Rug. They may be by Atria. Then there's ONL, Velo. So these are the popular brands of the oral nicotine pouches. Next, please. So Rush pouches, you can see they are being marketed. Next, please. Then you can see these pouches available at the e-commerce websites. Next, please. So though they are actually not legal in India, so these can be the violators can be held under Drugs and Cosmetic Act, because the Drugs and Cosmetic Act doesn't allow oral nicotine pouches. They allow only oral nicotine gums, patches, and lozenges. So these are the Instagram platforms on which these are available. Next, please. So online availability is very high. So that is the reason, one of the reasons that they are very popular with the kids and with the adolescents. Then their Twitter accounts also, they sell these nicotine pouches. Next, please. So what are the harmful effects of the nicotine on the human body? It may be addictive. So dependence may be there. Cardiovascular system, the blood pressure that rises because the nicotine is a vasoconstrictor. So blood pressure rises, and the rhythm may also be disturbed. The respiratory system will be affected because of the oral nicotine pouches. And exactly these may not cancer, but they can be promoters of the cancer. The reproductive health is affected. You see, because the nicotine chemical that causes nicotine in all over the body from head to toe. So anybody, all the organs they are affected. Then oral health problems are also there with the nicotine. Next, please. Then there can be environmental harms also. So because hazardous waste in the form of nicotine and the cellulase is produced, so it may also lead to environmental harms. So public health implications are there's very much lack of awareness about the health risks of the ONPs. Then there are challenges in the regulation and enforcement. Then there's need for stronger policies and public awareness campaigns. Increased nicotine addiction is also among youth because of these. So thank you. But I may just add that the oral nicotine pouches, though they may not be exactly illegal in India, but you can use those Drugs and Cosmetic Act, the Juvenile Justice Act against them, the Poison Act also can be used against these. So these can be tackled by the drug safety officers in India. So thanks a lot. Thank you.
That was indeed a very good presentation. Thank you so much for presenting that. We have a few questions from the audience. Let's go on to them one by one. My first question to you is, how should policymakers and healthcare professionals balance harm reduction with the new risk of nicotine addiction amongst non-smokers?
Actually, there's no concept of harm reduction with either electronic cigarettes or with the oral nicotine pouches because they may lead to dual usage. I mean, the tobacco cigarettes may be used, and along with that, e-cigarettes or the oral nicotine pouches can be used. And the harm reduction, that means that it is absolutely no harm is there. If you, I mean, drop down from 15 floors or 2 floors, you will definitely die, or maybe the bones are broken. So I don't think the term tobacco harm reduction or the harm reduction can apply to these. And moreover, the thing is that enforcement of the law is important. You must delegate the powers to the the drug safety officers, and they can act under drug safety and the Drug and Cosmetic Act. The Poison Act the police can act under the Poison Act, and Juvenile Justice Act also that can be used by police also.
Thank you for answering that.
In Juvenile Justice Act, actually, what is the provision in the Juvenile Justice Act? So there can be 7 years of imprisonment and 1 lakh fine. And any young person, minor, who is offered any addictive substance can be hauled under the Juvenile Justice Act. So that is a very potent act, actually.
Thank you for answering that. My next question to you is, how can healthcare professionals counsel patients who are transitioning to nicotine pouches, what key advice should be given?
Actually, the behavioral therapy is the same for tobacco cessation, whether it is for the tobacco or for the nicotine, because the main chemical is nicotine, and both are addictive in nature. So I think anybody who is trained for tobacco cessation, and even the national tobacco quit lines can be used, and you can guide the persons who are addicted to the nicotine. They can just go to the national tobacco quit line, and the number is 1-800-112-356. So they can go to that, and it can be very helpful. But surely a person who is trained in tobacco cessation, a doctor, can help the person better.
Thank you for answering that. My next question to you is, what does current evidence suggest about the safety profile of nicotine pouches compared to e-cigarettes and traditional tobacco?
Safety profile, I don't think, because the basic thing is that nicotine is there in all the three products, right? And the nicotine is the basic addictive substance. The cigarettes that may be burning, but the nicotine present in even in the electronic cigarettes, and the nicotine pouches as well. And I think the harms are the same, almost similar harms, because nicotine is a vasoconstrictor, and it may also lead to the pulmonary effects. Then neurological effects are there, the reproductive effects are there, and even they are all carcinogenic. I don't think there can be any comparison, because all three are harmful.
Thank you for answering that. And thank you so much, Dr. Gupta, for that insightful and thought provoking session. Your deep expertise and decade of public health leadership have truly helped us understand the growing risk of oral nicotine pouches and the role clinicians can play in prevention, counseling, and community awareness. A heartfelt thanks to all the doctors who joined us today as a part of 12th year anniversary series of Docplexus. Your participation and engagement continue to drive our mission of advancing clinical knowledge and improving health outcomes across communities. We look forward to seeing you in our upcoming anniversary webinars. Until then, take care and have a wonderful evening ahead. Thank you.